Hello, my hospice family. Hello, everybody. Welcome back to Dunshospice, okay, where we talk about end of life care, terminal illnesses, hospice care, okay? Um, Once again, guys, I'm going to ask you to please follow me, okay? Subscribe to my channel, follow me, so that we can help to spread the word of end of life care around, okay? And also please give me a like when you're watching the video. Please hit the like button, and I would love to hear your feedback, comment, please, okay? It would mean a lot to me. This will also motivate me to know which kind of contents you guys would like to hear, okay? Because I'm here to serve you, as I've said before. All right, so now that being said, I am going to talk about, this is going to be a continuation actually of my last video. If you haven't seen it, please take a look at it, where I went over heart disease, okay, heart disease regarding hospice care. Now in this video, so in the previous video I spoke about the criteria, okay, the criteria somebody would have to meet in order to qualify for hospice care. And it's a very, very good video. Please check it out. It's very informative, okay, really informative. Now I'm going to talk about, where hospice fit in. Once you are in hospice, once you are under hospice care for a diagnosis of heart disease, what happens now, okay? Now, your hospice nurse, okay, your case manager, the hospice nurse, who means she or he will be the primary person who's going to be handling your case. Now, her main role will be to make sure you are comfortable, okay, to manage your symptoms. And what that looks like would be making sure that you are able to breathe at ease, okay, trying to minimize your shortness of breath. If you recall in the previous video, I mentioned that when somebody is at heart failure, heart disease, it's really hard for them to breathe. They often experience shortness of breath, difficulty breathing. So the hospice nurse will be able to provide you with supplementary oxygen, okay, with oxygen. So you might be on 2 liters continuously. So she or he will manage your oxygen. So the hospice facility, the hospice company that you sign up with will be able to order you an oxygen concentrator, oxygen tanks, okay, keep it in your home to make sure that you get a little boost of oxygen in your system, especially when you are walking around, when you're doing activities, okay, just minimal activities, okay. It's very, very comforting to put your nasal cannula on to have that supplementary oxygen, okay. The other thing that the hospice nurse will do in terms of once you sign up with the facility is that they will definitely teach your caregivers on methods of how you can conserve energy. Yes, conserving your energy, it's huge. It kind of goes hand in hand with difficulty breathing, because if you are using too much energy, okay, when we are using a lot of energy, say when I am exercising, when I go up and down the stairs, or when I lift up my son, I'm using a lot of energy. Therefore, at times I get, it's hard for me to breathe, and I'm sure you are the same way too. So the hospice nurse will teach you ways, methods of how your caregiver, of how your loved ones can conserve their energy, okay? And one thing that they can do, a method that they can do, is that we can have a bedside commode. Okay, we can place a bedside commode right next to your bed, so that in the middle of the night, rather than your loved one having to get up, get out of bed, okay, walk to the bathroom, they can just go to the bathroom right next to their bed. Okay, if you need to pee, you don't have to get up in the middle of the night to go pee. You could just kind of roll over and pee, okay? Or we could use a urinal, okay? If you're a man, a urinal. If you're a lady, we can provide you with a bedpan Okay, so that's a little method. So those are some kind of like teaching methods that the hospice nurse will go over with you to conserve energy. And of course, there are other ways also. There are other tricks and other methods, other skills that, you know, we're going to be teaching you guys, other knowledge that we will teach you on what you can do based on your lifestyle to conserve as much energy so that you don't need to use as much oxygen. Okay, because when somebody is have a heart failure, okay, their lungs, their heart is not pumping strong enough. Therefore, they're not getting enough oxygen in their lungs. They're not getting enough oxygen in the rest of their bodies. Okay, so we want to preserve that. We want to make the person as comfortable as possible. We want to manage that symptom. Okay, so this is you know, this is how hospice, these are the main ways. Okay, there are different ways, but these are the main ways for now to know how hospice can come into your home and help your loved one who has been diagnosed with end-stage heart failure. Okay, so let me know, my hospice family, let me know if you know you are taking care of somebody who has heart failure, if you know somebody who has a heart condition. What are some of the techniques you're using? What is working, what's not working? Let me know if you have any questions. Okay, I would love to hear from you. Please share this video, hit the like button. Okay, and as always, I love you with the love of Jesus Christ. See you in the next video. All right, my Duns Hospice family. All right, take care now.